Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Electrosurgery or radiosurgery can be a valuable tool in the efficient practice of restorative dentistry. Here are some examples of how it can help you in your everyday practice. Let's say, for example, there's a very, very short crown to be used as a bridge abutment, and we want to elongate the crown. With electrosurgery, we can very quickly and efficiently remove the gingival tissue and make the crown much longer so that we have more retention as a bridge abutment. Very often when patients have lost anterior teeth and they're wearing temporary partials, or flippers as we call them, and they're wearing them for some length of time, the gingival tissue on the palatal side grows up over the lingual surfaces. And as it proliferates over this cingulum area, it hides the actual lingual architecture of the teeth. And very often we will have to, before we start the bridge, remove that extra tissue, and a very efficient way of doing that is with electrosurgery. We'll find also that there are areas where we'll want to change the ridge area. If there's not enough room to place an aesthetic facing in this particular area, then we can use electrosurgery to recontour the soft tissue. Another instance of the use of electrosurgery in restorative dentistry is when you have cervical caries and the gingival tissue grows into that particular lesion. If you try to remove that gingival tissue surgically, it usually will bleed profusely, and the flow of blood is rather difficult to control. This can be very efficiently removed with electrosurgery, and the beauty of electrosurgery is that it is a bloodless type of surgery where it cauterizes the soft tissue. You can remove that little tag of gingival tissue and proceed with your amalgam or your gold restoration. Now I'd like to show you the hardware that we will be using in the clinics. There are many types of electrosurgery units. The particular one that is in use here at the dental school is a Coles radiosurgery. This is a bi-terminal radiosurgery unit, and with a bi-terminal unit you need to conduct the current through the patient and to the machine. So there will be two electrodes, a plate that the patient will be leaning on, and also the surgical tip. And I will show those to you in just a moment. This basic unit then is usually turned to a setting of 3.5, and this is the amount of current going through the patient. Usually a setting of 3.5 will be sufficient for most cases. Now you will find in some instances where perhaps a patient is wearing heavy clothing or heavy elastic undergarments, you may have to kick this up to about 4.5. The unit is turned on, this switch over here, and then you will see that the line monitor then jumps up to the little black dot. There are two areas in where we will plug the various electrodes into. This metal plate, called an indifferent plate, is placed behind the patient's back on the chair, so they are sitting right against this, and then the other end of the wire that's connected to this plate is plugged into the portion of the unit called conductive. Now, as I mentioned, if the patient is wearing a suit coat or heavy clothing, have them take the suit coat off. And in the case of females where there's heavy undergarments, you have to place this perhaps up high on the shoulder. The second part of this conduction of the current through the patient then is the surgery tip And the surgery tip is plugged into the portion of the unit called surgery. And this, then the surgery tip or surgery electrode then will take various types of tips, various shapes of tips. Let me show you one of these tips. You'll notice that there is a black plastic insulator or sleeve around the metal. You have to be very, very careful that this brass metal is pushed all the way into this sleeve so that there's no metal showing. And if you have a little bit of metal like this showing and you're doing surgery with the tip over here, and this metal touches the patient's lip, they will be severely burned. So you have to be careful that that is pushed all the way in and then locked. After the unit then has been turned on, the current is controlled by this foot control. When you depress this foot control with your foot, this then completes the circuit of the current. And you'll notice also that this little indicator light then will come on as I push the control. It's very important to place this control in a guarded area so you don't step on it accidentally while you have that tip in the mouth, or have your dental assistant step on this while the tip is in an area where it could harm the patient. Now I'd like to show you the tips that are commonly used in the clinic. These electrode tips have various shapes, and this particular tip is called a troughing tip. And you'll notice it has a right angle bend, and the metallic portion of this tip is quite wide. This tip then is used to make a trough around the tooth to facilitate impression taking. You follow the architecture of the gingival crevice and actually make a trough to the base of the crevice all the way around the tooth, and then elastic impression material then can be easily injected down around your finishing lines. One of the dangers of this technique is if you do not know the architecture of this crevice, you can actually make the crevice much deeper than it was before you started, and therefore hasten the development of pocket formation. So when this troughing tip is used, great care should be exercised. The other tip I'd like to show you is the loop tip. And this tip looks almost like a hoop. It's a round ring of wire, and this can be used to remove broad areas of tissue. Like, for example, on this model, where we want to remove some of the soft tissue to make a little more room for our pontic, then this tip is used to remove these broad areas of tissue. The last tip I'd like to show is the actual straight wire surgery tip, and this is used to remove the soft tissue to the depth of the crevice. And here it's very, very important with a zero probe to measure the pocket or the crevice depth all the way around so that we know where we're going, and then the entire soft tissue is removed to the depth of the crevice, being careful not to touch bone, and then we can expect a regeneration of about 1.5 millimeters, again, of soft tissue. So in using this tip, you have to pre-plan. If you know that you're going to get 1.5 millimeters of regeneration, then you can about tell where you will put your finishing line. Now, it's rather difficult to use this on the lingual, so this type of tip can be bent. And very often we will make an auxiliary bend on this, as you can see here, and then we can use this then to come in on the lingual surface of central incisors to and anterior teeth to remove the gingival tissue in this particular area. Now, it's very important when these tips are used that the tip is kept clean, because if debris, blood, and tissue are allowed to accumulate on this tip, then it reduces its efficiency, and then we have to use more and more current. And then we would tend to burn the patient more than use this as a surgery tool that cuts efficiently. We're going to perform some electrosurgery on the lingual surfaces of the anterior abutment teeth. Usually when a patient wears a flipper or a temporary partial, for some length of time, the soft tissue on the lingual will grow up over the lingual surfaces of these anterior teeth. And in doing so, it will cover the cingulum, and it's very difficult to place a finishing line in these areas, so that we very frequently remove this excess tissue before we start the abutment preparations. The first step is to measure the pocket depth with a 0 or O probe, and as you can see, we have about a 3 millimeter pocket here. The sulcus is about 3 millimeters deep, and the cingulum is hidden. If we try to place a pin or a pin ledge in this particular area, we probably will get a pulp exposure because it gives us a false reference of where the pin really should be. When actually, when the cingulum is way out to the lingual here, the pin really should be much farther to the lingual surface. After you have measured the architecture of the sulcus and you know how deep it is in the configuration of the sulcus, then we will proceed to our electrosurgery. We usually will use a plastic evacuator tip to remove the odor. A plastic tip is very important because if a metal tip is touched with the cutting tip, the electrical impulse can be transmitted up the tip to the dental assistant. Also, we will use a plastic mirror. The electrosurgery is done in a brushing stroke. Bring that off of the gauze. And you'll notice that there's no bleeding associated with this type of surgery. This is one of the advantages of electrosurgery, that it is kind of an instant surgery that leaves a very clean field where it'll be very easy to take a rubber-based impression following this. Is that hurting? A little bit? Okay. Like more anesthesia? We just about finished with this central incisor here. It's very important that your dental assistant clean the tip off, because if the tip is clogged with tissue, then the cutting tip is very, very inefficient, and you have to use more and more current, and this can burn the tissue rather than cut. Okay, we're done with that one. We'll go to the next one then. Now we'll go over to the lateral incisor. Can you turn toward me just a bit? Okay. It's a little more difficult for me to see here. It's also permissible to bend the tip, and we find that we're having access difficulties here, so we will bend the surgical tip slightly so that we can get into this area a little easier. Open as wide as you can, please. Okay. You see that right there? Okay. Again, we use a brushing motion, light touch. Clean the debris away.
This procedure can be used also to lengthen crowns where it is difficult to get retention. Let's clean this up a little bit now. Okay, let's show this now. Now I'd like you to take a look at this. What we have essentially done then is we have just trimmed the soft tissue away, about 2 millimeters of tissue away on the lingual surface of the central incisor and the lingual surface of the lateral incisor. And if we had the preparations prepared at this time, we could take our impression at this point without any bleeding, without any tissue retraction. The patient will wear the flipper in this particular case until she comes in for the appointment for the preparation. We are going to perform electrosurgery on the lingual surfaces of the 2 maxillary cuspid teeth. This patient has been wearing a temporary partial or flipper for some time, and the soft tissue has grown up over the lingual surfaces of the cuspid teeth. Now, you'll notice when I do cut this soft tissue that I will use a sweeping cut. And you'll notice also that there's no bleeding associated with the type of surgery that we're doing. We're simply exposing the cervical finishing lines and lengthening the crown somewhat. From this angle. Can we see that all right? Okay. And you'll notice now that we have taken the soft tissue away, there's been no bleeding associated with this surgery, and we have now exposed our finishing line and lengthened the crown. Now we'll move over to the cuspid on the other side. Let me arrange this mirror so that it... Okay, can I say that? See that? Is that in the mirror? Okay, that looks good. Same thing on this side. You'll notice we'll use kind of a sweeping stroke. And we'll take the soft tissue away, and you notice that the assistant cleans this off. Now we get the nasal. Can you still see that? Okay. Still some on it, Elizabeth. Now we'll get the nasal portion of the crown. Now when I'm grabbing the tissue like this, the instrument is not on. The only time that I depress the foot control is when I'm actually cutting. Now we're going to deepen this just a little bit. There's a little more debris on that. Okay. You still see that all right? Okay. Tidy it up a little bit. And a little bit more on the lingual surface, and we'll be finished. You'll notice how efficiently, and I'll back this up so you can see both sides here. You'll notice that within a matter of just a minute that we have done the tissue surgery on both sides, and now it'll be very simple to take a rubber-based impression of these areas.
been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.